What would make an experienced emergency room nurse with 12 years of critical care experience suddenly question everything she thought she understood about medicine, consciousness, and the very nature of human life? In today's story, you'll meet Sarah Chen and discover what happened during one seemingly ordinary night shift at Memorial General Hospital that changed her perspective on emergency medicine forever. But before we begin, subscribe to the channel to help us reach our next milestone. Leave a like and comment below telling us about your most unexplainable experience. Now, settle in and listen carefully, because what you're about to hear will challenge everything you think you know about the boundaries between life and death. There are moments in a medical professional's career when you witness something that defies every textbook, every protocol, and every rational explanation you've been trained to rely on. These moments stay with you long after your shift ends, haunting your thoughts and making you question whether the world operates according don't fully understand. My two rules: we a registered nurse with 12 years of experience. Name is Sarah Chen, and I am over a decade, IPR clinical expertise, my ability to remain in emergency medicine. Prided myself on my calm during the most chaotic situations, and my unwavering commitment to evidence-based patient everything the care. I had seen emergency department could throw at me: trauma cases, cardiac arrests, overdoses, psychiatric emergencies, and countless medical mysteries that eventually revealed logical explanations. I thought I had witnessed the full spectrum of human suffering and recovery. I believed that medicine, while complex, operated within predictable parameters. Every symptom had a cause, every condition had a treatment protocol, and every patient response could be understood through established medical knowledge. I was completely wrong. The incident I'm about to describe occurred on October 14, 2023, during what began as a routine Saturday night shift at Memorial General Hospital's emergency department. Memorial General is a 400-bed teaching hospital located in the heart of downtown Portland, serving as the primary trauma center for the metropolitan area. Our emergency department sees approximately 85,000 patients annually, making it one of the busiest EDs on the West Coast. As the senior nurse in Trauma Bay 3, I was responsible for the most critical cases that arrived during my shift. After 12 years in emergency medicine, I had developed an almost intuitive ability to assess patient severity and coordinate complex medical interventions. My colleagues often relied on my experience to guide them through difficult cases, and I took pride in being someone they could count on during medical emergencies. That October evening started like countless others. I arrived at 6:45 p.m. for my 7:00 p.m. to 7:00 a.m. shift, reviewing the day shift's patient census and preparing for what promised to be another busy night. Saturday evenings in the ED were typically filled with alcohol-related injuries, domestic violence cases, and the usual array of medical emergencies that seemed to intensify as the weekend progressed. Dr. Michael Rodriguez was the attending physician that night, a seasoned emergency medicine doctor with 15 years of experience who had become something of a mentor to me over the years. We had worked together on hundreds of cases, developing the kind of professional rhythm that makes complex medical procedures seem almost choreographed. The nursing team that evening included Jennifer Walsh, a newer graduate with 3 years of experience, and Marcus Thompson, a veteran ED nurse who had been at Memorial General for over 20 years. Our respiratory therapist was Linda Kim, and we had Dr. Ashley Park as our resident, a third-year emergency medicine resident who was known for her thoroughness and clinical curiosity. The first several hours of the shift proceeded normally. We treated a motorcycle accident victim with multiple fractures, managed a severe asthma exacerbation in a teenage patient, and handled the typical assortment of chest pain, abdominal pain, and minor trauma cases that constitute the bread and butter of emergency medicine. It was at approximately 11:30 p.m. when everything changed. The ambulance radio crackled to life with a transmission that initially seemed routine. Memorial General. This is Medic 47 en route with a 34-year-old female, unconscious, found down at home by family members. No obvious trauma, vitals stable but patient completely unresponsive to all stimuli. ETA 12 minutes. I prepared Trauma Bay 3 for the incoming patient, setting up cardiac monitoring equipment, ensuring IV access supplies were ready, and coordinating with Dr. Rodriguez about our initial assessment plan. Unconscious patients found at home could represent anything from drug overdoses to stroke, diabetic emergencies, or toxic ingestions. The key was systematic evaluation and rapid identification of treatable causes. The ambulance arrived at 11:42 p.m., and the paramedics wheeled in a young woman who appeared to be in her early 30s. She was well dressed, with no obvious signs of trauma or distress, lying motionless on the stretcher with her eyes closed. Her breathing was regular, her color was good, and she appeared to be simply asleep rather than critically ill. This is Emma Rodriguez, 34 years old. The lead paramedic, Tony Martinez, reported as we transferred her to our bed. Family found her unconscious in her living room around 10:45 p.m. She was sitting in her chair watching television when her husband went to check on her and couldn't wake her up. No medical history we're aware of, no medications, no alcohol or drug use according to the family. Tony continued his report as we connected Emma to our monitoring equipment. Vitals have been completely stable throughout transport. Blood pressure 118/76, heart rate 72, and regular, respiration 16, oxygen saturation 98% on room air. Blood sugars 95, we've tried everything to wake her up. Verbal stimuli, physical stimuli, even painful stimuli, and she doesn't respond at all. It's like she's in the deepest sleep you've ever seen. Dr. Rodriguez began his initial examination while I documented vital signs and started an IV line. Emma's neurological presentation was immediately puzzling. She appeared to be in a deep, peaceful sleep, but showed no response to loud voices, physical touch, or even painful stimulation like pressure applied to her nail beds. Her reflexes were present but diminished, and her muscle tone was completely relaxed. "This is interesting," Dr. Rodriguez murmured as he examined her pupils with his pen light. Pupils are equal, round, and reactive to light. No signs of increased intracranial pressure. Neck is supple, no meningeal signs. Heart and lung sounds are completely normal. I had seen countless unconscious patients over the years, but Emma's presentation was uniquely puzzling. Most unconscious patients showed some response to stimulation, even if minimal. Patients with drug overdoses typically had specific vital sign abnormalities or physical findings that pointed toward particular substances. Stroke patients usually had focal neurological deficits or asymmetric findings. Diabetic emergencies were ruled out by her normal blood sugar. But Emma showed none of these patterns. "Let's get a full workup," Dr. Rodriguez ordered. Complete blood count, comprehensive metabolic panel, arterial blood gas, toxicology screen, urinalysis, and let's get a CT head to of her rule out any structural abnormalities. As I drew blood samples and coordinated with radiology for her head CT, I found myself studying Emma's face. She looked absolutely peaceful, as if she was experiencing the most restful sleep of her life. There was something almost serene about her appearance that seemed oddly inconsistent with the medical emergency that had brought her to our trauma bay. Her husband, David Rodriguez, arrived shortly after the ambulance and provided additional history that only deepened the mystery surrounding Emma's condition. "Dr. Rodriguez, Emma had been completely normal all day," David explained, his voice shaking with worry. "We had breakfast together this morning. Went grocery shopping, spent the afternoon working in our garden, talking. She was laughing, completely herself. Around 8 p.m., she settled into her favorite chair to watch a movie while I finished some work in my home office. David paused, running his hands through his hair. I cup of tea around brought her at 10:30, and she thanked me, said she was enjoying the movie. When I came back 15 minutes later to see if she wanted anything else, I found her exactly like this. Eyes closed, breathing normally, but I couldn't wake her up no matter what I tried. Dr. Rodriguez continued his questioning while I prepared Emma for transport to radiology. David, has Emma been under any unusual stress lately? Any changes in her routine, new medications, any complaints of headaches or other symptoms? Nothing at all, doctor. She's been perfectly healthy. She works as a graphic designer from home, so no workplace exposure to chemicals or anything unusual. She doesn't drink alcohol, never used drugs, takes only a daily vitamin. The only thing that was different today was that she seemed particularly happy and relaxed. She kept commenting on how beautiful everything looked, the flowers in our garden, the sunset. She said she felt more at peace than she had in years. This detail struck me as particularly odd. Patients who were about to experience medical emergencies typically didn't describe feeling unusually peaceful or content in the hours leading up to their collapse. If anything, most patients reported feeling unwell or different in some way before losing consciousness. The CT scan results came back completely normal. No signs of stroke, no brain hemorrhage, no masses or structural abnormalities that could explain Emma's unresponsive state. Her blood work was equally puzzling. Every single laboratory value came back within normal limits. Her toxicology screen was negative for all common drugs of abuse, prescription medications, and environmental toxins. This is really unusual, Dr. Park observed as we reviewed the results. I've never seen a patient with such profound unresponsiveness who has completely normal vital signs and normal diagnostic studies. Usually, there's something that points us in the right direction. Dr. Rodriguez ordered an EEG to evaluate Emma, hoping to identify seizure activity or other neurological abnorm EEG technician, Carol's brainwave activity, ALETES, that might explain her condition. The Stevens arrived within 30 minutes to begin the study. As Carol attached the electrodes to Emma's scalp, something remarkable happened. The moment the EEG leads made contact with Emma's skin, the machine began displaying brainwave patterns that Carol had never seen before. Dr. Rodriguez, you need to look at this immediately, Carol called out. Her voice filled with aren't normal brainwaves, but they're not abnilderment. These doing EEGs for AT normal either. I've been years, and I've never seen patterns around the EEG machine, staring at the display screen like these. We gather unconscious patient. Emma's EEG showed incredibly patterns you would expect from an organized, rhythmic waves, instead of the typical irregular brain wave that appeared to be synchronized of her brain. That across all regions patterns were beautiful in their complexity, almost musical in their regularity. These waves are too organized, too symmetrical, Dr. Rodriguez said, studying the printout. It's like her brain is operating in some kind of enhanced state rather than a diminished one. This doesn't look like unconsciousness at all. It looks like some kind of heightened awareness. But the most disturbing discovery was yet to come. As we continued monitoring Emma's EEG, we noticed that the brainwave patterns were changing in real time, becoming more complex and more organized with each passing minute we're watching her brain activity evolve into. It was as if we something beyond normal human consciousness. Carol, equipment functioning correctly? Is your asked, concerned that we might be dealing with a technical malfunction. I've checked everything twice, Carol replied. All the equipment is working perfectly. These readings are definitely coming from the patient, but I have no idea what they mean or what could be causing them. Dr. Rodriguez made a decision that would prove to be crucial. Let's try something. Sarah, I want you to talk to Emma while we monitor her EEG. See if her brain activity changes in response to verbal stimulation. I moved closer to Emma's bedside and began speaking to her in a normal conversational tone. Emma, my name is Sarah, and I'm your nurse here at Memorial General Hospital. Your husband David is here with you, and we're taking very good care of you. If you can hear me, we'd love for you to try to wake up or give us some sign that you're aware of what's happening. The response was immediate and extraordinary. The moment I began speaking, Emma's EEG pattern shifted dramatically. The organized waves became even more complex, displaying mathematical precision that seemed impossible for human brain activity. But more unsettling was the fact that her heart rate, which had remained steady at 72 beats per minute since her arrival, suddenly changed to exactly match the rhythm of my speech patterns. "Are you seeing this?" Dr. Park whispered, pointing to the cardiac monitor. "Her heart rate is synchronizing with Sarah's voice inflections. That's neurologically impossible." I continued talking to Emma, and her physiological responses continued to mirror my speech patterns with uncanny precision. When I spoke slowly and calmly, her heart rate decreased accordingly. When I raised my voice or spoke more quickly, her heart rate increased to match. It was as if her entire cardiovascular system was responding to auditory input in ways that defied medical understanding. But the most remarkable change occurred when I began asking Emma direct questions. "Emma, if you can hear me and understand what I'm saying, could you try to change your breathing pattern? Maybe take a deeper breath or breathe a little faster." Within seconds of my request, Emma's respiratory rate changed from 16 breaths per minute to 20, then back to 16, then to 14. She was clearly responding to my instructions, but she remained completely unconscious by all other measures. Her eyes stayed closed. She showed no voluntary muscle movement, and she didn't respond to physical stimulation. Dr. Rodriguez stared at the monitors in complete bewilderment. "She's following verbal commands while remaining everything completely unresponsive to else. This is medically impossible. Patients don't selectively respond to some stimuli while ignoring others unless there's a specific neurological explanation, and her brain imaging is completely normal." As the night progressed, Emma's responses became even more sophisticated and disturbing. She began demonstrating knowledge that she shouldn't have had access to from her unconscious state. When I mentioned that her husband David was in the waiting room, Emma's breathing pattern immediately changed to a specific rhythm that perfectly matched the way David had been breathing when I last saw him pacing anxiously outside the trauma bay. This was information she couldn't possibly have known while unconscious in our treatment room. "Emma, your husband mentioned that you were watching a movie when this happened. Can you tell us what movie it was by changing your heart rate?" I asked, feeling somewhat foolish for attempting to communicate with an unconscious patient in such an unconventional way. Emma's heart rate shifted to 87 beats per minute and held that pattern for exactly 30 seconds before returning to baseline. I had no idea what significance that number might have, but Dr. Rodriguez immediately grabbed his phone and called David in the waiting room. "David, this might sound strange, but what movie was Emma watching when you found her unconscious?" Dr. Rodriguez asked. There was a pause before David's voice came through the phone speaker. "She was watching Titanic. She loves that movie, always says it reminds her of how precious life is." Dr. Rodriguez looked at me with an expression I had never seen before. "David, do you happen to know what year Titanic was released?" "Of course, 1997. But why are you asking about movies? Is Emma going to be okay?" We ended the call without fully answering David's question, both of us staring at Emma's peaceful form with growing unease. Her heart rate had indicated 87, and we had just learned she was watching a movie from 1997. The mathematical relationship was too precise to be coincidental. Dr. Park had been quietly observing the entire interaction. Let's test this further. Sarah, ask her something specific that only someone with access to current information would know. I felt ridiculous, but the scientific part of my mind was fascinated by what we were witnessing. Emma, if you're somehow aware of what's happening around you, could you tell us how many people are currently in Trauma Bay 1 by adjusting your respiratory rate? Emma's breathing immediately changed from 16 breaths per minute to 23. I walked quickly to Trauma Bay 1 and counted. Dr. Martinez was treating a patient with chest pain, assisted by 2 nurses, 1 respiratory therapist, and 2 family members. 6 people total, plus the patient made 7. But Emma had indicated 23. I was about to dismiss her response as meaningless when I noticed something that made my blood run cold. The digital clock on the Trauma Bay 1 wall read 23:47. Emma wasn't counting people. She was somehow reading the time display in a room she had never been in and couldn't possibly see from her location. Dr. Rodriguez, we need to document everything that's happening here, I said, my voice barely steady. This patient is demonstrating awareness of information that's physically impossible for her to access. Either our understanding of consciousness is completely wrong, or we're witnessing something that challenges the basic principles of neurology. Over the next hour, we conducted increasingly complex tests of Emma's impossible awareness. She correctly identified the number of vehicles in the hospital parking lot by adjusting her heart rate. She indicated the exact temperature reading from the thermostat in the nurse's station by changing her blood pressure. Most disturbing of all, she accurately predicted incoming ambulance arrivals by altering her oxygen saturation levels minutes before we received radio calls from paramedics. Marcus Thompson, our veteran nurse, had been quietly observing our interactions with Emma. Finally, he approached me with a concerned expression. Sarah, I need to tell you something. In 20 years of emergency nursing, I've seen exactly 3 patients who demonstrated this kind of impossible awareness. All 3 cases occurred during night shifts. All 3 patients were young women. And all 3 patients eventually what, Marcus? I asked. They never woke up. 2 of them were transferred to other facilities for extended neurological evaluation. The third one, Marcus paused, glancing around to ensure no one else was listening. The third one was here about 5 years ago. Her name was Jennifer Walsh. Same age as this patient, same presentation. After 3 days of testing that revealed nothing abnormal, she simply stopped breathing. No medical explanation, no underlying pathology. It was like she chose to leave. I felt a chill run down my spine. Marcus, are you suggesting that Emma might not recover from this condition? I'm suggesting that whatever's happening to Emma isn't medical in any conventional sense. These patients seem to exist in some state between normal consciousness and something else entirely. And in my experience, they don't stay in our world very long. Dr. Rodriguez had been listening to our conversation. Marcus, do you have any documentation from those previous cases? Unofficial notes, mostly. The hospital administration discouraged detailed documentation of cases that couldn't be medically explained. But I kept personal records because I knew someday we'd see this again. As Marcus retrieved his private files, Emma's condition began to evolve in ways that made her earlier responses seem simple by comparison. Her EEG patterns started displaying mathematical sequences that corresponded to complex equations. When Dr. Park, who had studied biomedical engineering before medical school, recognized the patterns as solutions to calculus problems, We realized Emma was somehow processing information at a level that far exceeded normal human cognitive capacity. These aren't random brain waves, Dr. Park explained, studying the EEG printouts. These patterns are solving mathematical problems in real time, but Emma works as a graphic designer. According to her husband, she barely passed high school algebra. The most unsettling development occurred when Emma began responding to questions that hadn't been asked aloud. I would think of a question about her condition, and her vital signs would change in ways that provided accurate answers before I verbalized my thoughts. It was as if she had access not only to environmental information throughout the hospital, but to the thoughts and intentions of the medical staff treating her. When I mentally wondered about the results of lab work that hadn't yet been processed, Emma's heart rate would indicate the exact values that appeared on our computer system 20 minutes later. When Dr. Rodriguez silently calculated medication dosages, Emma's respiratory rate would adjust to display the correct milligram amounts. "This is beyond medical science," Dr. Rodriguez admitted, as we reviewed 4 hours of documentation from Emma's case. "We're dealing with consciousness that operates outside physical limitations. Emma isn't just unconscious. She's existing in some expanded state of awareness that allows her to access information through means we don't understand." Carol, our EEG technician, had been monitoring Emma's brain activity throughout the night. "Doctors, I need to show you something. Emma's brainwave patterns have been evolving all night, becoming more complex and organized. But in the last 30 minutes, they've started to change in a different way." She showed us the most recent EEG tracings. Emma's brainwaves were beginning to slow down, becoming less complex and more similar to normal sleep patterns. But the change wasn't random. The patterns were shifting in a way that seemed intentional, as if Emma was deliberately transitioning from her state of impossible awareness back toward normal consciousness. "It's like she's preparing to wake up," Carol observed. "But the transition control is too purposeful to be a natural emergence from unconsciousness." I returned to Emma's bedside, uncertain whether she was still able to hear and respond to verbal communication. "Emma, if you're preparing to wake up, we want you to know that we've been taking care of you. Your husband David is here, and he's very worried about you. If you can hear me, please try to open your eyes." For the first time since her arrival, Emma showed visible physical response. Her eyelids fluttered slightly, and her fingers moved in what appeared to be voluntary muscle activity. But instead of the gradual awakening we expected, Emma's eyes opened suddenly and completely, as if she had been awake the entire time and simply chose that moment to acknowledge our presence. "Hello, Sarah," Emma said clearly, her voice calm and completely alert. "Thank you for taking such good care of me tonight." The fact that she knew my name, which had only been mentioned during our one-way conversations while she was unconscious, was startling enough. But Emma's next words would haunt me for the rest of my nursing career. "I need to tell you something important about the nature of consciousness and what happens to human awareness during medical crises. What you witnessed tonight was just the beginning of something much more significant." Emma sat up in bed with an ease that seemed impossible for someone who had been completely unresponsive for over 6 hours. Her movements were fluid and purposeful, showing no signs of the disorientation or weakness typically associated with prolonged unconsciousness. She looked directly at each of us with eyes that seemed to hold knowledge far beyond her years. "Dr. Rodriguez, your confusion is understandable," Emma continued, her voice carrying an odd quality that made every word seem significant. "What you've documented tonight, it challenges medical understanding, because consciousness isn't confined to the brain in the way your textbooks describe. During my unconscious state, I wasn't actually unconscious at all. I was experiencing awareness from a perspective that exists outside physical limitations. Dr. Rodriguez approached her bedside cautiously. Emma, we need to run some tests to make sure you're medically stable. You've been unresponsive for over 6 hours, and we need to understand what happened to you. Emma smiled with a serenity that felt almost otherworldly. I understand your concern, doctor, but I'm perfectly healthy. What happened tonight wasn't a medical emergency in any conventional sense. It was something else entirely. Something that occasionally happens to certain individuals during periods of deep relaxation or meditation. She turned to look directly at me. Sarah, you've been wondering whether other patients might experience similar states of expanded awareness during medical procedures. The answer is yes, but most people don't remember these experiences when they return to normal consciousness. I'm different because I was meant to remember, meant to share what I learned. The hair on my arms stood up. Emma was referencing thoughts I had been having throughout the night but had never spoken aloud. Her ability to access unverbalized concerns was continuing even after her return to apparent normal consciousness. What exactly did you learn? Dr. Park asked, her scientific curiosity overcoming her medical caution. Emma's expression became more serious. I learned that human consciousness exists independently of brain function under certain circumstances. During my unconscious state, my awareness expanded beyond my physical body, allowing me to observe not just this room, but the entire hospital, and even events occurring in locations I had never been before. She paused, looking at each of us carefully before continuing. But more importantly, I learned that some patients who appear to be unconscious during medical procedures are actually experiencing heightened awareness. They can see everything happening to them, understand conversations among medical staff, and even access information about other patients and hospital operations. Dr. Rodriguez frowned. Emma, that's not medically possible. Unconscious patients don't have access to environmental awareness, and they certainly can't process complex information. Dr. Rodriguez, I know this challenges your medical training, but I'm telling you what I experienced firsthand. While you were treating me, I was aware of everything happening in Trauma Bay 1, Trauma Bay 2, the surgical suite on the 3rd floor, and even conversations taking place in the hospital administration offices. To prove her point, Emma began describing specific details about patients and procedures that had occurred throughout the hospital during her unconscious state. She accurately described a cardiac surgery that had been performed 2 floors above us, including the surgeon's technique and the patient's vital signs during critical moments of the procedure. She knew about a medication error that had been quietly corrected in the pediatric ward, and she even described a confidential meeting between hospital administrators about detail. Emma. Every concerns budgetifiable and provided was verd-accurate, describing events she couldn't possibly have known about from her position in our trauma bay. Marcus Thompson had been listening to Emma's account with growing recognition. Emma, you mentioned that you were meant to remember these experiences. What do you mean by that? Emma turned to Marcus with a knowing look. You've seen this before, haven't you, Marcus? Other patients who demonstrated impossible awareness during unconscious states. You kept records because you knew these cases represented something significant. Marcus nodded slowly. 3 other cases over the past 20 years. All young women, all with the same type of expanded consciousness you're describing. But those patients never recovered normal consciousness the way you have. Those patients weren't supposed to return, Emma said quietly. They were transitioning to a different state of existence entirely. Their consciousness was expanding beyond the point where it could maintain connection to physical form. I was allowed to experience that same expansion temporarily, but I was meant to return and share what I learned. The implications of Emma's words were deeply unsettling. She seemed to be suggesting that some patients who appeared to die from unexplained causes were actually undergoing consciousness transitions that medical science couldn't recognize or understand. Dr. Rodriguez attempted to steer the conversation back toward medical evaluation. Emma, regardless of what you believe happened, we need to complete our assessment. Your diagnostic studies were all normal, but you've been unconscious for hours without it be any identifiable medical cause. Emma, nonchalantly. Doctor, I'll cooperate with any you feel tests necessary, but I want you to understand that what happened tonight has implications for your entire approach to patient care. There are patients in this hospital right now who appear unconscious, but are actually experiencing expanded awareness, similar to what I described. She gestured toward the cardiac monitor that was still displaying her vital signs. Room 312 has a patient who's been in a coma for 3 weeks following a car accident. The medical team believes he has no awareness, but he's actually conscious and can hear every conversation taking place around his bed. He's frustrated because he can't communicate, and he's particularly distressed when family members discuss discontinuing his life support. Dr. Park immediately grabbed her phone to contact the neurological ICU. After a brief conversation, she returned with a puzzled expression. Emma, there is a coma patient in room 312 who's been unresponsive for 3 weeks following motor vehicle trauma. How could you possibly know about his case? Because I could observe his consciousness while I was in my expanded state, Emma replied matter-of-factly. His awareness exists independently of his damaged brain tissue. He's trapped in a body that can't respond, but his consciousness is intact and desperately trying to communicate. Emma went on to describe specific details about the coma patient's condition, his family members, and even conversations that had taken place in his room during the previous days. Every detail she provided was accurate according to the nursing staff who had been caring for him. That night changed everything I thought I knew about consciousness, medicine, and the nature of human awareness. Emma recovered completely and was discharged the following morning, but her case forced me to question whether we truly understand what happens to patients during critical medical situations. 6 months later, I left emergency nursing, unable to provide care without wondering which unconscious patients might actually be experiencing expanded awareness beyond our medical comprehension.